afternoon, everyone. I'm Captain Rehorst with the Watertown Police Department. I'm one of the PIOs with the Watertown Task Force. Up first today, we have Mayor Sarah Karen with our community update.
Thank you. It's April 10th, 2020. Our COVID numbers in the state are up to 536 with 6 deaths. Cottington County still has a total of 12 cases, and we are now showing that 11 have recovered. These numbers show that the measures we have taken are working, and we're very happy about that. All people meeting the symptom criteria should get tested for COVID-19. Because testing supplies are short, though, not everyone qualifies to be tested. The healthcare providers will determine if you meet the criteria for testing, so please call first before going in. Now that we have had a number of positive tests in our community, people are wondering about what to do if they think they may have been exposed to someone who tested positive for COVID-19. The CDC recently released guidelines about this. Essentially, you should monitor your symptoms for 14 days. This means take your temperature daily. Don't go to work or go out if your temperature is 100.4 degrees or greater. Cover your mouth and nose with a face cloth when out in public or at work. Leave the medical grade masks for the healthcare professionals. Go home if you are at work or out and about and you start to feel sick. Call your healthcare provider if you have a fever of 100.4, a dry cough, or shortness of breath. Practice social distancing of 6 feet at all times. Don't congregate in the break room at work, and continue to wash hands frequently and disinfect surfaces regularly. Governor Nome acknowledged that Easter weekend is a popular time for extended families to get together, but she urged us all to stay home. If you decide to travel, or if you host travelers, be sure to take steps to help prevent getting or spreading COVID-19 before, during, and after your visit. You may become exposed to COVID-19 and not realize it. You should monitor your temperature and symptoms for 14 days following your visit, just as though you were exposed to COVID-19. Again, call your healthcare provider if you have a fever over 100.4, a dry cough, or shortness of breath. Wear a face cloth when out in public, and of course, stay 6 feet or more away from other people all the time. Wash your hands and disinfect surfaces. When we follow these simple practices, we're protecting those we love along with our entire community. Our unified efforts will lessen the impact of COVID-19 on our town. Our efforts are working, and we need to stay strong for one another. We will get through this together. Thank you. And now I would like to introduce Terry Kelly, the Acting Director of the Watertown Department of Parks, Recreation, and Forestry.
Thank you, Mayor. What I'd like to do today is update the public on some of our key seasonal facilities. As we approach the season, the weather obviously is getting nicer, and the public is wondering where we stand with multiple facilities. What I'd like to do today is focus on some of those key facilities, and what I'd like to start with is our campground at Stokes Thomas City Park. Through meetings and discussions amongst the state, not only municipal campgrounds but state campgrounds, we have determined that effective May 1st, provided things have looked a little better, but May 1 we will open the campground to the public with the following restrictions. We will not open the comfort stations. The restroom facilities, shower facilities will remain closed to the public. What we will allow is each site to be occupied by a immediate family or anybody living within the same residence. Anybody that wants to visit that campground will be subject to the social distancing guidelines. In addition to that, our playgrounds will be closed, and we will discuss future payments, whether we do a reservation system or a pay-as-you-come-in system. But the campground is planning on opening on May 1, 2020 to the public, and what I would like to reiterate is we are not doing any outside marketing. We are not pursuing a draw regionally. This would be a situation for local residents to have an outlet to come camp. As long as they follow those guidelines, we will do it based simply on per family, per residence, per spot, with no bathhouse, and we will have water and electricity available at each site. Therefore, we do ask that each camping unit is equipped with its own restroom. We will not allow tenters for the fact of there are no restroom facilities. So that is an update on Stokes Thomas Lake City Park Campground. Again, May 1st, we do plan on opening to the public and with certain restrictions to ensure that we meet the CDC guidelines. The next facility, one of our key facilities this time of year, is Cattail Crossing Golf Course. We have now been open for roughly about 1 week. We do have guidelines in place. Those guidelines are set up and do prevent the social distancing, ensure that we are not infecting one another. But what we do ask is the people and the patrons, the players, do adhere to those guidelines. When you go out there, you can see a list of rules and regulations that we have modified, and we do ask the public at this point to ensure you follow those. We have met as not only the staff, but as our board, that if we do see individuals purposely not adhering to those, we will ask probably those individuals to remove themselves from the course to ensure that we do maintain a safe environment. So Cattail Crossing will remain open with the certain guidelines, but I will stress that we do expect the players and patrons to adhere to the new guidelines that we presented, and we will do our best to help you if you have any questions on how to adhere to those. The third facility I would like to touch on is the Watertown Family Aquatic Center. That is a facility that is really an unknown at this point. We do plan on continuing to prep that facility. We will not get to the point of adding water, but we will be prepared if we do lessen restrictions to be able to open it. Our thoughts as a staff is that if we cannot open by June 1, the financial contribution to get that facility open will not be justified if we cannot open by June 1 just because of the short season. But we are behind the scenes making sure that we are prepared both on the staffing level, making sure we have everything we need to open that facility. That is one facility at this point is definitely a to be determined facility. We will do everything in our power to open that, but it's based on the restrictions at the time. It does take us 2 to 3 weeks once we get that release of restrictions to be able to open. So our hopes is that it opens, but that is one that we cannot guarantee at this point, and we'll do everything we can. Everything else within the Park and Rec Department is status quo as far as what we've announced through the media before. Our playgrounds remain shut down. We do ask that anything that involves the same equipment usage, things like you restrict from, we do encourage you to be out there using our open green spaces, our bike trails, to that nature. So we do want to provide the public an outlet, something for recreation, but we are definitely holding true to the CDC guidelines. So with that, I will turn it back over to whoever's next. So thank you.
Hello, my name is Shannon Britt. I'm the infection control nurse at Prairie Lakes Healthcare Systems. Some of these things you've heard before, but I just think it's nice to reiterate some of the information that you've heard from me and from others in the healthcare entity. For COVID, so we're holding well and we're doing great in Cottington County, but I want you aware of the symptoms. And again, I get all my information from the Centers for Disease Control and Prevention and from the South Dakota Department of Health. There are a lot of resources available, but these are the sources we use for consistent guidelines and followings. Symptoms for COVID can range from mild symptoms to a severe illness, just depending per person.
These symptoms can appear 2 to 14 days after being exposed to COVID. Those symptoms being fever over 100 degrees, cough, or shortness of breath. To reiterate what the mayor said, if you feel that you have signs and symptoms of COVID, please contact your healthcare provider or the emergency department prior to your arrival so we can prepare for your arrival so that we don't expose other people to the potential of COVID. Your healthcare provider then will determine if you meet criteria to be tested. The State Department of Health has given us guidelines in which the people we can and cannot test. We have to have signs and symptoms, and also depending if you're a healthcare worker, first responder, active military, if you've been hospitalized or you're in the hospital, or if you live in an institutional setting. There's other guidelines that we need to follow also. Unfortunately, we cannot test everybody that would like to be tested. One way to help with preventing COVID from getting to others is to prevent the spread. And that spread happens between people in close contact. We think and believe it's about 6 feet apart. It is transmitted through respiratory droplets when we cough, sneeze, and talk. And those droplets then get in the other person's mouth, nose, or eyes. Then we get them inhaled into our lungs, and COVID, the virus starts to replicate, and we become COVID positive. One way to prevent the spread is to avoid close contact. That's less than 6 feet away for less than 5 minutes. Stay home as much as possible. I know it's starting to be nice out, and we look forward to these days in the Dakotas to get out of our homes, but we can do that in smart ways. We can be in our yards. We can go for walks. Just stay 6 feet away from people and keep it for less than minutes at a time. Remember, there's other people out there that might not be able to handle getting COVID, or there's also people that could not have symptoms and be able to shed the virus. That was new information we found out last Friday from the CDC, is that studies now have proven we can be shedding the virus and be asymptomatic, as well as you could shed the virus a couple days before you have symptoms. So we urge you to stay 6 feet away from others. CDC has also recommended wearing the cloth covers or cloth masks. As Mayor said, please do not use health grade masks. Those are necessary for us to have to be able to provide care in the event that you would end up in the hospital. We do not have an overabundance of health grade masks, and that is a nationwide issue. Remember to clean your hands often. First and best way to clean your hands is to wash with soap and water. Again, wash your hands, scrub for 20 seconds. And that's the amount of time it takes to sing happy birthday to yourself 2 times. And then rinse your hands. Remember to dry your hands with a towel, and then use the towel to shut off the faucet. It's pointless to wash your hands, shut off the faucet, and then dry them with a towel, because you just picked your germs back up from the faucet handle. If you're not in an excess of soap and water, then you can use the hand sanitizer. Make sure it's at least 60% alcohol. Times that's good to wash your hands after blowing your nose, coughing, or sneezing into your hands. But a way to avoid that is just remember to cough and sneeze into the crook of your elbow. Remember to wash your hands after using the restroom, before preparing or eating food. After you've been in contact with animal or pets. If you've frequently touched surface items such as keypads, gas pumps, shopping carts. After you've touched door handles. We're asking if you order out from places that are doing delivery, wash your hands after you pick up that delivery item and before you eat the food that you've ordered. And after going through your mail from the post office, wash your hands. We're finding ourselves to have a new normal. We're washing our hands more than we used to. And I hope that carries on to continue to keep us healthy even after COVID is done. Also be good about cleaning and disinfecting in your homes on frequently touched items daily, such as your tables, doorknobs, light switches, countertops. If you're concerned about your face cloth coverings, they don't have to be fancy. You can use an old shirt. CDC has guidelines on how to cut those to not even have to sew, as well as a bandana tied around your mouth. It helps keep those viruses and the spores to you so that you don't spread them to someone else, even though you might not even seem sick. How do you clean these face cloth coverings? Launder them in your washing machine like you would do with any of your other clothes. Again, we stress the importance of social distancing. And why is that so important? It's because of that spread that can happen within 6 feet from coughing and sneezing. We ask that you avoid large and small gatherings in private enclosed spaces. I know we've had a good time in our neighborhood putting signs in windows to our neighbors to see what chuckle we can get out of each other, just to have this be a little more fun during the time frame, or we yell at each other across the alley to say hi. If you're advised by the Department of Health to stay home from work because you've been exposed or you do have COVID, they will walk you through this. But right now, as a guidance, what we follow is that you need to be 3 days, at least 72 hours of not having a fever without the use of medication. You need to have an improvement in your respiratory symptoms, such as your cough or shortness of breath. And it needs to at least be 7 days since your symptoms first appeared. So if you feel you have COVID, please follow these instructions. If you choose to go to your healthcare provider or not, please at least stay home for 7 days and be sure that you do not have a fever. Or limit your contact with other people as not to spread that to them. We had been asked at one point, can someone who has had COVID-19 spread the illness to others? And CDC says at this time there's no evidence someone who has been released from isolation is considered a pose as a risk to others. And the South Dakota Department of Health has a nice guideline and pictures to help walk through those opportunities if you've been exposed and have come out of isolation. Can someone who's been quarantined for COVID spread the illness to others? And CDC says current evidence suggests that if a person meets criteria to come out of quarantine, they are not considered at risk for spreading the virus. But it is very important to follow all the quarantine and isolation rules. Can people who recover from COVID be reinfected with the virus SARS-CoV-2? That is the name of the virus that causes COVID. Based on previous coronavirus infections, people are unlikely to be reinfected shortly after they recover. It is still unknown how long the immune response will last. We have a lot of information still to learn about COVID, but we're learning so many things. Thank you.
All right, thank you, Mayor Karen, Terry, and Shannon. At this time, we'll open up to the media if you have any questions.
Question for Mayor Karen. Obviously, you answered a variation of this question yesterday, but obviously as the recovery numbers tick up, and I know things could change about determine how many cases any given day, but if the cases stay the same and we get that final person recovered, could there be talk about maybe kind of relaxing the restrictions on businesses sooner rather than later, or just what's your perspective on that?
Actually, the Unified Commanders discussed this in our meeting today, and it was pretty well agreed that it's too soon to start talking about backing off on the measures because we really haven't seen around us that the cases are dropping. So we may not have even had our activity here yet. So it's too soon to talk about that.
Okay, and then question for Terry. Thank you. Terry, obviously, golf course has been open for about a week now, and then obviously the guidelines are in place. Are you able to kind of get a sense of how well people are adhering to the guidelines at the golf course?
You know, we are. The guidelines are there for safety, and I would say we're well over the 90% rate of follow. And what we've discussed as staff, Dan, it's a case of, it seems like there's always one or two, you know, and we talked about it. It's like the highway has a speed limit of 65. There's going to be people that go 70, and we're trying to identify those people. And first, just talk with them and say, you know, here's why we have, you know, these changes in place. But overall, I do think majority of the public is adhering to our modifications. We're doing everything we can. Everything that we have set up is in place to provide a safe environment. And we do rely on the users to adhere to those. Short of putting out a golf course marshal with every group, we simply, don't have the manpower, and we do trust that our users are adhering to it. And when we identify somebody that's not, we are taking action as far as a verbal, this conversation. And if it gets to the point, we will remove those people that just don't want to follow our guidelines from the facility. We don't want to ruin it for the whole, for a couple people that just seem immune to what's going on, so. But overall, I do believe we have a very high success rate on people realizing it's a privilege. And we want to keep it open, and therefore I do think they're adhering. And we do have one or two that we do talk to daily to ensure that they understand the reasons we're doing what we're doing.
All right, thank you very much.
Yep, thank you.
Are there any other questions from the media? All right, if not, I'd just like to mention a few last things before we go. First is, don't forget, everyone in the public there, you can drop off those homemade masks at the Salvation Army Monday through Friday from 9 a.m. to 5 p.m. They can be from any cotton or cotton-type blend material. Go ahead and drop those off. We're still in need of those. And another thing is the blood drives that are coming up next week. We still have Wednesday, April 16th, taking place there. You can go on and register at cbblifeblood.org, and you can register for those. Those are by appointment only. So, and the last thing I'd like to say, not only for my DARE students, but for the whole public, as you go out to this Easter weekend, be safe. Don't take any unnecessary risks, which might expose you to COVID or expose someone else to COVID. And then be responsible. And I really want you to think about what are your obligations to not only your family, your friends, your neighbors, the community, and think about those obligations as you go about your weekend activities here this Easter. So as you go out,